Welcome. This is Village in Motion. I am Clint Lambert. Today is Thursday, April 26th, and we have a discussion. I have a discussion this morning in the studio with two members of the Ancillary Health Services Committee from the Resident Council. And on my left, I have Deanna DeMember, who is the council liaison to the Ancillary Health Services Committee, and Sally Sutton, who is a member of the committee. And ladies, welcome.
Thank you.
Glad to have you.
Pleased to be here.
Good. What is ancillary health?
Ancillary health is it's several things. It's home health, and it also, the home health now also goes to Garden Ridge, so that you're in Garden Ridge and have a home health nurse aide. You will have that continuum of care when you go back to your apartment and have the same person.
Okay.
And that's working out very well. We also are having the aid, the ability to have them for a full hour rather than a half an hour.
All right.
And the system's been reorganized with more full-time aides. That improves the consistency of the care.
Okay. So is it just home health or home support, or is there other?
It's home support. More staff is being hired also for escort services to wheel you over to the, or even if you're on a walker, to accompany you to the doctor, to the medical center.
Okay. So that's the companion component, right?
Yes, there is that also. Yes.
Okay, so we've got home health, home support,
Right.
and companion.
You're right.
Is physical therapy under all of that?
It is billable to your long-term care insurance.
Okay.
And staff will also help the families with the forms that they need to fill out to apply for reimbursement.
Okay. But the physical therapy component here at Green Spring,
That's separate.
that's totally separate,
That's separate.
From the committee.
Yes,
okay?
yes, yes.
And from that area. So then just really three areas then?
Well, we used to have hospice. We no longer have our own hospice.
Right.
However, the local hospices are caring for several patients in our community.
All right, okay. So people can still stay here and
Yes.
still use hospice
Right,
and hospice
right,
care.
right.
Okay. And so is the committee then working with the hospice people that come in, or getting information about how many people are in hospice or any of those areas?
We do get statistics occasionally, yes.
Okay.
And also, we're working with the staff, including hospice, with the whole staff of Ancillary Health, to have educational forums. And this year we'll have 2 of those on the same day over at Hunter's Crossing to accommodate more people so more families can attend.
All right, very good. And the committee has how many members?
Let's see, about 7 or 8.
Okay,
Yeah,
all right.
yeah.
And Sally, you're one of those members.
Yes.
And you've been on the committees for a while, the different committees, and even the council for a while, right?
Yes, I was. I have.
Yeah.
And I wanted to try this committee because it was one I felt I needed to learn something about. It can be confusing to the residents and to me, and so I thought this was a good opportunity to get some education, as well as hopefully help in some way. And the forums that Deanna mentioned is one way that the committee can help get those planned and set up and so forth. And when she mentioned we'd have 2 on one day, there'd be one during the day and one in the evening, so that families can come, because I think it's hard to wait until there's an emergency and then take in all the information that's given to you. And if you have a preview, I think that really helps.
So the forms that you're talking about, are they the information that's going out that finance is working with in conjunction with you, or is that totally separate?
That's totally separate, yes,
Okay.
yes.
So your forms, the forms that you're talking about, are purely health-related
Right.
forms?
The services
support.
that are...
Home support, okay. And what kind of information will people be able to gain from those?
Well, the variety of care, the level of for instance, an aide is more like a companion,
Okay.
and or they can help you prepare breakfast or whatever your needs may be early in the morning, or bathing and that sort of thing.
Okay.
And then we have registered nurses also who visit and administer drugs or injections or whatever needs to be done.
Okay. And following the doctor's orders.
Exactly, exactly.
Okay, in regards to that. So I want to come back to the fact of you being a member, because I think it's fascinating, and all residents need to know because they have the opportunity of how did you go about becoming a member of the committee?
Well, in the fall, after the council members are elected, everyone is given a form in their cubby to sign up for committees they would like to serve on. And you give a first, second, and third choice, and then the members of the council assign people, hopefully based on your first and second and third choices. And so when that form came out, I filled it out. And as you say, having been on the council and been liaison to several of the other committees, I wanted to try something different and something that I felt I needed education about. So I filled out the form and made that choice, and I got my first choice.
Yeah. And historically, that's what's typically happens,
Yes.
is that people get their first choice. A few people get their second choice if everybody wants one committee, and it fills up very rapidly.
Right.
But people get their first and second choices. I've never heard about or experienced anyone getting only a third choice in regards to it. So,
No, I haven't either.
which I think is very nice, and all residents can do that, whether
Yes.
they've had any knowledge or about whatever they're doing. They have to live here for a period of time, right?
A year, I think.
1 year, right? And it's a great way to learn what goes on
Yes.
from a resident standpoint
Yes, it
with these
is.
different committees and with administration and just the governance.
And we have some members who are former social workers and some former nurses.
Oh, okay.
And they have a great input into our decision-making and consideration and when they're discussing various aspects.
Who attends to represent home support, home health, companion?
Well, Donna Epps joins us when she can, but she's the director of
Resident
Resident
life.
Life, right.
Resident Life, and this comes under her purview,
Okay.
but she has so many areas. Often she cannot attend. Sometimes one of the nursing directors on staff comes, sometimes a social worker, and all are very knowledgeable about what's going on and what the latest situations or services, what services may have changed or
Okay.
that sort of thing.
All right. And so the committee meets when?
We meet the first Wednesday of the month
Of every month?
at 2:30. Yes.
Okay. For
on a
at
Wednesday.
2:30 for what, an hour, hour and a half?
It's usually just about an hour.
About an hour? And where do you meet?
We meet in the Village Square classroom.
Okay. And so a way of residents deciding which committee they might want to be on, when it comes out for volunteering on the sheet, on the back side usually of that sheet, it tells residents where the various committees meet, the time they
Right.
meet,
Right.
type thing, and so people can select.
What fits into their schedule and their interest, yes.
Right, okay, in regards to that. In the committee meetings, what kind of things do you guys discuss? What's the essence of the meeting? Sally?
Well, one of the things is being educated about, with Donna or whoever is representing the staff at that meeting, usually has some topic that we frequently have asked them to talk to us about, so that we understand better what is going on and how you go about getting those services, et cetera. And then as it gets closer to the fall, when we are going to do the forums, we'll be discussing, I'm sure, although I haven't been there since this is my first time on this committee, but I'm sure we'll be discussing the format of those and what we think would be the residents want to know,
Okay.
and who should present that information.
Do you guys ask, or does the committee put out any kind of survey or a questionnaire to residents in general of what kind of information they would like from the committee?
We haven't done that yet, but that's a good idea.
Yeah.
It is a very good idea.
Because one of the things that, I'm hearing a lot of, especially this year, is the fact of residents really wanting input. And I think all along with residents have always wanted input, but there seems to be a special push this year to try to get input in regards to things. So I would really encourage you to, ask the
Excellent.
residents, what they want in regards to that. With this, what would help you guys, and what would help the committee most, and the council most in regards to things? What could residents do?
Well, I think be educated, and as you say, we could be responsible for that and helping them become educated on what we do. And because, as Sally had said previously, if you wait until the last minute and you suddenly have an emergency and come back to your apartment and need care, you need to know all the services that are available and who to call.
Okay. Sally, I saw you with a pamphlet earlier. And what does it have in regards to things? Is this something residents can get?
Yes, these are available around the mailboxes where the pamphlets are in each village.
You might want to hold it up so
This
maybe
is
the
home
camera can
support.
get
I don't know. And this is home health. And these are, now I will tell you that it says Green Spring, but they are put out by corporate. And one of the things before we came on today was Deanna and I were talking about the fact that the people that they show on here are
Healthy
don't look like they need help. Now we don't want them to put somebody that's seriously ill on it, perhaps, but that's something that we're going to have a few words or send a note to corporate and say, this is something we'd like you to consider.
Right. So really, people can identify with the information. Speaking of the information, what's contained within those pamphlets?
It tells what like for instance, this is home health care. It tells what it is, why it's important. And one of the things I have learned, for instance, about home health care is when it says health, it involves nursing.
Okay.
It involves trained nursing. The home support also involves training, but they are aides. They are trained as aides, and they can't give medication, for instance, things that you and I might take for granted and think they would be able to. They can say to the client, it's time to take your medication, and watch them take it, but they can't give it to them.
That's really good to point that out, I think, in regards to identifying it, that anything that has health in it means it's professional nursing involved and licensed individuals in regards to that. Whereas if it does not have that, it's aides that can provide support and encouragement, but they can't become truly involved in the health care of that individual.
And more aides and nursing staff are being hired on an hourly basis. It used to be you'd get somebody for half an hour, and now you can have an hour, and they try to be consistent with the employee that they sent, so you develop a relationship. And that's working out much better.
Great.
And there's so many just things I didn't realize that they can do, such as she mentioned fixing breakfast. They can also walk a dog. There are all kinds of responsibilities that they can take over for the resident, particularly if it's a situation where you just need a few days to feel a little stronger to be able to do this.
In order to get a home health person, there needs to be a physician's order, right?
Yes.
Yes.
Okay. And that's very specific. The nurse comes in and evaluates the person, right?
Right.
Yeah, and there's no charge for that evaluation,
there's no
which I
charge for that
think
evaluation.
is very good.
Yes. And what, it runs from about 30 minutes to an hour for the evaluation?
I haven't had one, so I don't know. But
I think about a half an hour.
About a half hour in regards to it, which is nice. I mean, to be able to do that. And then I understand that the RN goes back and determines what care that the individual really
Right,
needs, and then
right.
assigns someone to come and take care of the person, right?
Right.
Okay. But with home support, how do you get a home support person?
You
Call them?
you call the same number and tell them what you want. And again, they will send somebody up to determine exactly what you do need, because perhaps the person doesn't think they need home health, or perhaps a professional will evaluate to see exactly the care that they need.
All right. With the care that you get and the person that you get, do you have to have a Greenspring aide, or can you have someone else?
Well, there are other outside aides that are hired by some people here. Yes,
Okay.
yes.
So there's no requirement as far as
No.
Greenspring is
No.
concerned, right?
No.
Because I think it's very important for families to know that they truly have a choice
Yes,
in
yes.
regards
yes,
to who
yes,
they have
yes.
caring for
We
them.
do encourage
Yeah.
people using the Greenspring aides because they've been interviewed, they've been vetted, there's a certain amount of safety. It's someone that
Right.
has, as I say, been interviewed by Greenspring, and they feel comfortable with this person taking on these duties.
So Greenspring takes responsibility for the individual
Yes.
that they hire?
Yes. Yes.
Okay. And so do you know, I know at one point there was a lot of concern about whether or not aides that work for Greenspring were having security checks. Do you know, is that?
Oh, I believe they are.
They
Yes.
are now?
I'm sure, yeah.
Okay, in regards to that, all right. So you have that comfort
Yes.
in
yes,
knowing, okay?
yes.
Whereas if you hire someone off the street or from an agency, you really don't know, do you?
Yeah.
No. And the other nice thing, and I don't know about private agencies, but it's really a 24/7 opportunity. I mean, if in the middle of the night something happens and you need they have emergency calls, and
Tremendous.
so that is nice to know too. And weekends and times that I hear so many people say, well, it was Saturday, there was no one to call. Well, there are people to
Right,
call,
right.
Yes.
and to me that's comforting, because it seems like it's Murphy's Law that you get sick on a weekend.
Right,
and
exactly. And so if you have an emergency number that you would call?
It's the same number, I
the
believe.
It's the same number, but that's, I think, is for patients who are already in the system, isn't it?
Not necessarily,
No?
I don't
No,
think.
okay.
I mean, if I fell and was taken to the healthplex and they said, well, you can go back, but you need someone with you,
Oh, okay. Okay.
Okay.
you can,
We keep learning.
Yeah,
they can, find someone for you.
great, very good. Deanna, you just said something, we keep learning, and I think all of us keep learning here at Greenspring in regards to things, and as we age, we learn more and more, although we may forget what we've learned. But again, it might be something the committee might want to do, of putting out what all you can do 24 hours a day, and what can they provide you, and how would you go about getting that information? I mean, and getting that resource that you need.
That's a good idea, and we will cover that in our forms also. Yes.
Good,
Yeah.
good. With the forms, I'm assuming that you would have a manager from home support?
We'll have a complete staff from home support
Okay.
in all areas. Yes,
Very
yes,
good.
including the social workers also. Yes.
Okay. Does home support now and home health now have managers? I know at one time
Yes.
they did not.
Yes.
They now have
They do.
individual managers?
They do.
Okay. And they answer to Donna Epps, right?
That's right. That's right. And we have hired a new administrator for the certified home health, and she'll come on board in June, and that will lighten Donna's load quite a
Okay.
bit.
Very good. With all the things Donna has, it's really important to get the information coming up from the grassroots, right?
Right.
In regards
Yes,
to it.
yes.
And so it's incumbent upon us as residents to make sure our aides or our nurses know what our needs are.
Right, exactly. And to keep in touch with home health and get them feedback on how things are going.
Yeah, okay.
Yeah.
with that, do residents that have nurses or aides have the opportunity to fill out comment cards or anything along those lines?
I don't know if they have comment cards, but that's a good idea.
Yeah, I'm just wondering how's a user of the service evaluate the service and let people know, you know, if they're satisfied, not satisfied.
That's an excellent idea.
That's something we need to find out.
We need to find out ourselves.
Because I would certainly want to be able to give that feedback and say,
Right, right.
you know, I'm not satisfied with this particular employee or the way that they went about doing this or the service or the lack of service.
Yeah. I mean, I think that's done by phone quite a bit, but I don't know that there's a form. But that's a very good idea.
Okay. Because some of us would rather fill out forms and talk on the phone in regards to things. Because then you know that somebody's going to get it and they have to read it.
Right.
As opposed to maybe they wouldn't pass along the information if it's simply a phone call in regards.
I know they do that at the medical center, and it's been very helpful.
Right. Exactly. You guys and your committee doesn't have anything to do with the medical center, right?
No. No, that's a different.
It's a totally different under the Health Services Committee, right? Okay. But Donna has resident life and ancillary health services, right?
Yes, she does. Yes.
And so resident life has a whole different group of individuals and a different committee.
Right.
And ancillary health has you guys and your committee.
Right.
Okay. In regards.
Our committee is relatively new, isn't
Yes,
it? I mean,
yes.
in the scheme of things, as you know, some of the committees have been around a long time.
Right.
But that was one of the reasons, was because when it was part of Resident Life Committee, there was so much that that committee, just as there's so much for Donna,
Right.
that we felt we needed to have a separate group.
Okay. Okay. In fact, if I remember right, when I was president, we didn't have an ancillary health.
Right,
No.
right.
Yeah.
It's just
So-
been the last few
So it
years.
started in 16 then, 2016.
About that time.
Because my last year was 15 in regards to it. So only a couple of years, this is the third year.
Right.
Really, of
Yeah, I
it
think
Right.
that's
in
right.
regards to it, compared to 20 years of all the other committees.
True.
So you're just the babies in the group.
I guess we are.
With your committee, you said you've got about 7 people on there. Do you have room for additional people?
Yes, we could always use more people.
Okay. So if somebody wanted to join now after they've seen the show and they've learned something about the committee, what would they do? Would they be able to?
Yes, I think so.
Okay. And how would they go about that?
They could call either Donna's office and talk to Beth, or they could call me.
Okay. So Deanna, DeMember, right?
Right.
And you're in the phone book.
Yes.
Okay. Or Sally, do you want a phone call too?
Certainly, but
Or Sally Sutton. And that you guys then could guide them through the process.
Sure,
and
sure.
Get them connected with the right people.
Be happy to.
and I have known cases where someone called and said, just could I come and visit the committee? And I, you know,
Just to
they
see
would
what
they
we
would
do.
understand if we were voting on anything, which I don't know how often we vote, but then they wouldn't have a vote. But they could certainly come and see if this was a good fit for them.
And we have our chair is Don Webb, who's this is his second year or second term,
Right.
and our secretary is Bob Clark, and they're both doing a very fine job.
Very, very good. And Don's been very active with the committee.
Yes, she has.
You know,
Yes.
he has.
Whenever she's able, whenever she
Are
has.
you
he-
talking about Don or Donna?
Don. Oh yes, yes, yes.
Yeah. And he's been out and about and
Yes.
doing things.
Yeah.
And he's taking advantage of our health care today.
That's right. That's right.
So, not with us. Okay. With all of this, we're very, very glad that you came. A lot of information. Is there anything else that you'd like to share before we close?
No, thank you so much for having us. I can't think of anything else. I think you've covered
Okay.
pretty well.
Thank you. Yeah, I
Oh,
think
my
we have too,
pleasure.
and I hope.
Oh,
Thank you.
yes, yeah.
I just was going to say, you know, I hope people will perhaps look at the pamphlets and come to the forums and bring family members.
Okay. And they can get the pamphlets where?
Anywhere at all the mailboxes, there's a rack of
Okay.
pamphlets, and they're there.
Okay, so each of the town center areas, each of the
Right.
community buildings.
Right.
Okay.
Right. Right.
So grab a pamphlet and read it.
And the forums will be in October, and we'll come up with our more definite date.
Okay.
But they will be in October.
All right. Yeah, so put it on your calendar for
Right.
October to attend the forum.
Right.
And we don't know how many forums there will actually be, right?
We're going to have one in the afternoon and one in the evening to accommodate more family members, because
Okay.
the family members are the ones who may be making the decisions if the patient isn't able to.
Okay, very, very good. Well, folks, thank you. And we
Thank
hope
you.
that everybody have enjoyed this show today and have learned something.
Thank you
Thank
for
you.
giving us the opportunity.
Thank you
Our
so much.
pleasure. But